Good morning and welcome to this mass Zoom call for National Education Union members. I would love to be able this morning to say welcome to each and every one of you individually, but just saying hello to Dawn in Barrow, Sarah in Dudley, Leah from Essex, Sabrina in Watford, Michael in Southport, Matt in Southend-on-Sea. You are all representatives of our union and you've joined this call this morning because of your concerns about the situation that we find ourselves in as a nation, as professionals, and within the schools and colleges and settings where we work. I'm Robin Bevan. I am a serving head teacher and I am your elected national president. Across the last few months as a serving head teacher, I know how demanding and challenging the experiences have been for all of us in the education workforce. I know that that stretches back to last March, and I just want to start this call with words of profound thanks and appreciation to every single one of you. You, our education workforce, have been utterly extraordinary. Let's just cast our minds, first of all, back to March briefly, when within 3 days, you were able, across school and college settings all across the country, to move the provision of our school curriculum from classroom to online learning. And whatever may be said about that period, it was the most successful public sector IT project that has ever occurred in this country. It was exceptional, and your work and your dedication to that was remarkable. Many of you in differing roles were working to support vulnerable children and key workers on site. Many of you were working to make contact with those children at home alongside providing education for them throughout the summer period. Your commitment to providing free school meals, to getting in contact with families who needed help, doing it not just term time, but weekends, holidays, and through the summer. You worked tirelessly as a committed and dedicated professional workforce to bring about the successful reopening of schools in September under very significant and challenging constraints. You were extraordinary. And anybody who is on this call now who has been working in any setting, early years, post-16, in Wales, in England, Northern Ireland, every single one of you should at this particular point just take stock and consider what you have done for the benefit of our learners, the children in your care, the young people in your care. And we all know that it became harder and harder to fulfill our professional jobs as we approached Christmas. Firstly, and I'm going to be direct about this because the government patently failed to include schools and colleges in the national lockdown. So whilst everybody else mid-autumn was staying at home, there were 10 million workers, children and learners in our schools and colleges. And because of that, as term then progressed towards Christmas, it became increasingly difficult to manage the context in which we were working. In my own school, by the end of the last week of the autumn term, I had a third of my teaching staff in self-isolation and more than half of the pupils. It was exceptionally well run, superbly done by all the staff I work with, but chaotic in terms of any serious management of the provision of education in our country. And then we entered the Christmas holiday, and many of you, I include myself here, did not have the opportunity to meet with close members of your family. We followed the instructions of the government in relation to the public health guidance. And then just a few days after that situation, we found ourselves in a position where the Secretary of State for Education, with very limited notice, with inadequate preparation, announced the reopening of schools and in some instances in our primary and early years settings, the reopening of schools to all pupils into overcrowded classrooms with no additional protection at the time at which the infection rates in our communities are at their very highest. The view of the union is that it is time for each and every one of our members individually to say no. And to be quite honest, that is the reason why you have joined this call today. Because you know that it is in the best interests of the communities you serve, the children you teach, to say we are not proceeding in the way the government has recommended. We don't need to be told about children needing face-to-face education. That's what the union wants. But what we want is to ensure that every single community is protected, every member of staff supported, and that we move as swiftly as possible through safe measures to a position where we can readmit every pupil back into our schools. But today is the day to say no to the proposals that the Secretary of State has put in front of us. I know also that there will be some of you on this call who across the last many months have lost friends or members of your family to the COVID virus. And I would like, just before I hand over to Mary, to express my condolences to all of you who have lost fellow workers during this crisis. Welcome. Thank you for joining this call, whatever your role, whatever your workplace, whatever your setting, you are very welcome. And please, we will do our very best across the next 45 minutes to an hour to answer your questions and explain the reasoning behind the decisions made by your national executive yesterday. Mary.
Thank you, Robin, and good morning, everyone, and a warm welcome from Robin, Kevin and myself to this extraordinary National Education Union Zoom meeting. We welcome people who are joining us on social media and people who have been able to get into this webinar. And we've called this meeting because we want to update you on the NEU's position about members' health and safety during the pandemic. And we're going to do that update very shortly. But I just wanted, from Kevin and myself, also to thank you, as Robin has done, and to tell you how much we admire you for the heroic efforts that you made last term to keep education going for your pupils and to look after vulnerable children. Without anything like adequate government support, you carried on working in crowded buildings with no social distancing and with inadequate ventilation to teach children and young people. As Robin said, some of you on this call will have caught COVID. Many others of you will have had to have isolated because you've been in close contact with a colleague or a pupil. And you will know also that school leaders' efforts have been heroic, keeping their schools open with inadequate resources and depleted staffing. They have done the work that should have been done by the Public Health Service to operate tracking for pupils, working throughout the weekend, late into the evening, and right over the Christmas holidays.
Unfortunately, everybody was so tired by the end of Christmas, and unfortunately, the situation is getting worse, not getting better. We're all so hopeful for the vaccine, but the new strain of the virus is 70% more infectious than the original strain. And we know that children, whilst still highly unlikely to be seriously ill if they get COVID, some are, but it is highly unlikely, they are able to spread the virus to adults, both in schools and in the community. And there is substantial scientific thought that the current variant is more transmissible amongst children. That's not altogether certain, but that's where the science looks like it's going. We know that the measures that the government put in place in schools and colleges last term were not sufficient to stop the spread of the virus amongst children and young people. We asked for far more measures than the government put in place, but the measures they put in place did not stop the virus spreading. So primary age children, by the end of the school year, by the end of the school term, were the second most infected of all age groups, surpassed only by secondary pupils, who had the highest infection rate of any age group. Secondary pupils, the infection rate had increased 75 times from September to the middle of December. Things were bad enough before we discovered in the past few weeks that there are new strains of the virus that are more infectious. And we now know that the government's own scientific advisors in SAGE, they told ministers on the 22nd of December, they said it is highly unlikely that measures with the stringency and adherence in line with the measures in England in November, that is with schools open, it's highly unlikely that that would be sufficient to maintain R below 1 in the presence of the new variant. It's also, they also said it's not known even whether the measures from the spring would keep R below 1. and they said that they needed till mid-January they needed till mid-January to assess what was happening with the tier 4 measures and the school holidays to work out what was happening. So SAGE are saying to the government that it's highly unlikely that R will become below 1 for the virus to stop growing if schools are open. They say the rate of infection will be lower if schools were closed. Not only SAGE, but a paper from the London School of Hygiene and Tropical Medicine, where John Edmonds was an author, he's a member of SAGE, they said that in a scientific paper on the 23rd of December, and a paper from Imperial College, where Neil Ferguson, also a member of SAGE, was an author, said the same thing on the 31st of December. So that's where the science is going.
So what is the NEU advising its primary members? This is really important. This is what we are advising you to do. We are advising all primary members to look at the SAGE advice and, on the basis of the science, tell their head teacher that it is unsafe to be in a school teaching full classes in crowded buildings with no social distancing, no PPE and inadequate ventilation. We have a letter on the NEU website that you can send to your head, that you can use this letter as a model to send to your head. The letter on the website explains that you are available to work from home and you are available to support remote learning. And if not clinically extremely vulnerable, or if you're not high risk, you are available to be in school supporting key worker or vulnerable children. The NEU's strong advice for our members and their colleagues, based on the science, is that it is not safe for primary, early year settings or special schools to open for full classes at present. We have written to every employer and head teacher giving this same advice and asking them to make preparations for a move to remote learning instead, with the exception of key worker children and vulnerable children. We believe that members should advise their head teacher that if their school nevertheless opens on Monday, they will not be attending the workplace, but they will be available to work remotely from home. We are providing the model letter for primary, early years and special members to send to their head, as I've said, on our website. When you send this letter, if you decide to send this letter, you will be asserting your legal right to be protected against any detrimental action by your employer. And the right is explained in full in the model letter.
Now, the same advice applies in both early years settings and special school settings, as well as primary. It applies to our teacher members and to our support staff members. There's some more complication in special schools. We want heads in special schools to draw a distinction between being vulnerable and having an EHCP, and that does require a little more discussion at school level about how best to draw that distinction. Our advice also applies in Wales. We don't think schools should be opening to full classes in the first 2 weeks of January in Wales either. Our advice generally applies to secondary schools and colleges. But given the slightly delayed start there, in this call, we are concentrating on primary, early years. We will have further Zooms next week. We do want secondary colleagues on this call, though, to show solidarity, and because the political argument is the same, and we're going to raise some political points about the petition. So thank you for secondary colleagues being here. Thank you for London colleagues who are primary teachers or primary support staff being here. We want to tell you that this is not a case of pitting staff against head teachers in any way. Our president, Robin, is a serving head teacher. We have spoken with NAHT and ASCL. We have many head teachers in membership of our union, but we've also spoken with NAHT and ASCL, and they are giving advice to their members that is sympathetic to the stand that we're taking, not hostile to it. They are telling their members that if they do not have enough staff, they have to move to online learning, that it is a good and reasonable and professional thing for them to do to move to online learning. They are also saying that if an NEU member says to the head that it's not safe to be in school in the way our letter describes, that the member of NAHT or ASCL is in no position to say that it is safe. NAHT and ASCL have written to the government yesterday, raising concerns about safety and asking for assurances. It's important to say that at the moment, our advice applies to at least the first 2 weeks of term. It's important to say that we are giving this advice because the advice given to the government by SAGE was that schools should remain closed in order to help reduce the spread of COVID-19 virus, and they needed at least to the middle of January to assess further. Infection rates generally in our society are considerably higher than when schools closed at the end of last term. That increase has been promoted by the new variant, and at the moment, we do not fully understand the implications of that. It's also important to say that workers in this country have a right to not work in unsafe settings, and they can exercise that right even if the threat is to someone else. So, for example, a building worker could refuse to work in a building if they thought that it was about to fall down on passers-by. They have a legal right to do that. So when we're talking about the threats and the legal right, it's both about threats to our members, teachers and support staff, and it's also about threats to parents and grandparents.
There is already a lot of movement as a result of the stance, our position that we announced yesterday. We've heard, just for example, that the Association of Kent Head Teachers is calling for online learning and for schools to be shut. Birmingham Council is saying that it will support schools if they felt it wasn't safe to open. The Birmingham MPs, Jack Droney and Liam Byrne, are supporting our call. Brighton Council has told its schools to close. Liverpool Council is about to issue a positive support for our stance. The 3 Liverpool MPs, Kim Johnson, Ian Byrne and Dan Carden, support our stance. The Swale Academy Trust are moving their schools, all their schools, onto online learning in Kent and East Sussex. Unison is about to endorse the use of Section 44. The NAHT, ASCL and the NASUWT are all calling for a period of online learning. And just some messages on our WhatsApp reps group this morning. These are messages from reps. Letter sent to the head this morning. All members agree. We also said that if the government does a U-turn, we want our Section 44 to be noted regardless, as we aren't prepared to be teaching whole classes of children. Good response from our head after we sent our letter this morning, saying she expected it, checking the names had been consulted, and that there was an expectation of remote teaching, as she wouldn't be able to open the classes of the teachers concerned, so the children will learn from home. And she'll give further clarification later. Thanks for the prompt response. The head has emailed to say that she has emailed Kirsten, the Director of Education, to say classes closed to those who signed the letter, and it will be remote learning for these classes. Our Unison reps are contacting their members, and they hope their members will get it sent as soon as possible. In my school, the secondary, they have agreed for staff to work from home unless they wish to go in. I had one primary rep who asked me yesterday, is it okay if they only have 6 out of 7 members who have agreed to do the Section 44 so far? I am sure that they will get the other member too.
So we know there's a lot of progress. We've just heard from Norfolk, which is not a particularly radical Labour type authority. And they've issued guidance which says safety is paramount. And we recognise that head teachers have the delegated responsibility to make the decision to close schools. If you are not certain that you have safe staffing levels, you may decide not to open for the majority of pupils on Monday. And then we've heard from another rep. My workplace has always been very against any sort of strike action. This isn't strike action. Yet the vast majority of members have signed the letter because the feeling is so strong. I spoke to my head, this rep says, who is extremely anti our union, and she was grateful to those who had signed it. She said it makes her life easier, her decision for tomorrow easier. And the same rep says to us, I've had a number of messages from a wide variety of people not in education, thanking us for the stand that we're taking. One which obviously really made me cry, from a woman in hospital fighting for her life. A single mum of 4 children who caught COVID from her mum who works in a school and had done nothing but work and go home and didn't, they're sure that she contracted it in school. We've heard from Durham, as these are just examples, but 500 members on a call in Durham yesterday. 16 schools, 100 NEU members had already sent the Section 44 letters, and lots more people joining the NEU. The local MP giving a message of support. They've arranged a public meeting for tonight where they already have 300 parents, 300 signed up, 229 are parents, and 81% of them agreeing with the union that the school should not open at the moment, and with 5% a bit unsure about it. These are all positive steps.
So, you know, when you look at what we might be reported in some newspapers, or if you go to Twitter, and you'll see the union being attacked, that's not nice. That's not nice when it happens. But we firmly believe that the National Education Union is the responsible body in all of this. And it's interesting that increasingly other people are saying so. Peter Foster at the Financial Times has said, why isn't the government looking at the science? Why isn't it taking the advice of SAGE that unless schools are closed throughout January, it's unlikely with this new variant that the reproduction rate of the virus will fall below 1. And there's an editorial today in the Sunday Times which acknowledges our case. But what does our government do with its own scientific advisors? It ignores the advice that it is given, and it tells primary schools to open from the 4th of January, even in many tier 4 areas where the virus is spreading quickly. In ignoring the advice of SAGE, the government is behaving, in our view, recklessly, without thought or care for children, their parents, the community, and in particular without thought or care for the NHS, which is becoming overwhelmed in many areas with COVID cases. We believe that the government is itself creating the conditions for the faster spread of the virus, with highest daily totals since the pandemic began last March, and the highest number of severely ill patients in hospital. Now, let it not be said that we are against schools being open. We want all schools to be open for all pupils. We are education professionals. It is our daily job. We know to the very core of our being, and we do not need to be lectured about how important education is for the life chances of children and their well-being. But opening schools against its own scientific advice, in doing this, the government is acting without care or concern. It's failing to protect children, their families, and their communities. The government is failing in its duty of care to education staff who have worked so tirelessly to look after children during this pandemic. So we have made the serious decision to call on all primary schools to remain closed, except for key worker and vulnerable children, for 2 weeks, from the 4th to the 18th of January, in order for viral levels to reduce in the community, and for the government to work with us to put safe measures in place which will allow primary schools to reopen safely. Secondary schools on the government's current planning will open on the 11th of January to years 11 and 13, and a week later to all pupils. We will be examining closely the course of the pandemic during these weeks to see if we can support this position, and we will say more as things become clearer.
It's really important to say we aren't the ones who want schools to be closed. We supported the opening of schools in September. We called for safety measures which the government didn't put in place. And that is what's led to the increase in cases. I was on the radio this morning on LBC, and I told people on Twitter that I was doing that. And members came back and said, please say, this was a day, we don't want online. It's more difficult. The reason we're saying this is it's about safety. So I did make that point. We don't want schools closed forever. We're calling on the government to use a period of remote learning to establish the rate of transmission of the new variant of the virus amongst students, and from students to their parents and to staff, in order to keep families safe and to keep staff safe. We want the government to use that period to establish measures which could keep schools and colleges COVID secure. The introduction of proper mass testing, with adequate time and resources to ensure its rollout. The vaccination of education staff, starting with the most vulnerable, the establishment of rotas in secondary schools. There are things that could be done that could make things more COVID secure than they are currently. There is more we will want to say in the members' call on Tuesday, so please join that, including around secondary schools. But we do want to stick with the situation mainly around primary, special and early years on the call today. I will say one thing for any supply members who are on the call. We think if you have an ongoing engagement with a school, it should be honoured, including during a period of online learning. If you, though, have lost out financially because of schools closing, the union has established a hardship fund. It can't replace all of your earnings, but there is a form on the website and people have applied for those grants and you can apply more than once. So we'll just say that to supply members. We'll come back to other things on Tuesday, but we want to stick now with primary, special and early years.
We've sent you an email with a link to a model letter. So that letter is in your email. If you feel your workplace is unsafe, and we think it is unsafe, we advise you to send this letter to your head teacher. If you're in a school with a rep, we want you to tell your rep that you are taking this course of action. And we asked reps in a call yesterday to call member meetings so that you can support each other. It does not need to be an individual letter. A group of members can individually make the decision to sign a joint letter. They must all make that individual decision, but you can sign a joint letter. If you don't have a school rep in your school and you're concerned about sending the letter or about your head's reaction, or you're concerned that you're going to get into trouble or that you'll be disciplined, then please get in touch with your local branch secretary. Their names and telephone numbers are on the website and they're on your membership card. Or get in touch with our regional office and they will support you.
If there isn't a rep in your school, we would really seriously like you to consider becoming the rep. You can be a COVID rep just for the length of this pandemic. Hundreds of people have stepped up during the course of the pandemic to volunteer to be reps for us. We can provide training quickly. More than 100 people volunteered yesterday. So if there is no rep in your school, please do consider volunteering. Now, your head teacher cannot reasonably say to you that it is safe to return to school. They wouldn't, to teaching whole classes. They would not be able to evidence that position because all the evidence points to the contrary. So if that is your head teacher's response, we think that will not be the case in most head teachers. But if that is their response, politely but firmly disagree, restate your position, say it's the position of your union and that your union is citing Sage, Imperial College, the other evidence. If you are put under undue pressure, your rep will support you. If you don't have a rep in your school, your branch will support you. We believe that a snowball effect could be created by the positive stories we've had today. There are an enormous number of people on this call. There are an enormous number of people watching on social media. If those people agree with us, agree with Sage, with Imperial College, with the London School of Hygiene and Tropical Medicine, that it is unsafe for schools to be open. And then if they take the step of sending the letter, which they can find in their email or on our website, then there will be consequences of lots of people individually doing that, and it will turn quantity into quality. We will hold further meetings next week, including about secondary schools and colleges. But we are really grateful for secondary school and college members being on the call today, because there's an element of this where we have to try and persuade the government politically about it. And one step we're taking, we are making ground on that, as Mary talked about earlier, but we've launched a petition yesterday for safe schools and sustainable education. We've launched it jointly with Unison. Just overnight, more than 200,000 people have signed it. And we want you all to sign it. We want you to encourage all of the members of staff in your school to sign it. And we want you to ask them, and we want you to ask your friends and family to sign it as well. It will be a real sign of belief in what we're doing. So just to reiterate, our advice is that we should follow the science from SAGE and the other bodies that I've talked about. Our advice is that you are legally entitled to refuse to work in an unsafe setting, and that will, in our advice, that would include teaching whole classes in at least the first 2 weeks. Our advice is that you can send the letter on our website, and we believe that will help head teachers who want to do the right thing. What we're asking is the right thing for education. It's the right thing for our communities. It's the right thing for staff and for parents and for grandparents. If the government had taken our advice last term, we think cases would have been lower. There is a chance that we wouldn't be in this position now. We're following the science. We want you to follow the science as well. Please do volunteer to be a rep if you're not one. That's the end of our presentation, and we're very happy to take questions. We know that we're not going to be able to answer all the hundreds and hundreds of questions that have been asked, but we'll give it a go.
Thank you very much, Kevin. Thank you, Mary. And thank you once again to everybody who's joined the call. I'm going to focus quite a few of the questions to Kevin and Mary around just making sure that key points of the message today are heard. So some of this may sound like a repeat, but I think it's really important that we make sure that everybody on the call understands some of the key details here. And one of the first questions that I just want to put to Kevin, please, comes from Paul Armstrong, and he's saying, are you talking about tier 3 as well, or just those in tier 4? And I want to expand Paul's question a little bit, and thank you, Paul, for posting it, because it is a key question. I want to expand it a little bit and say, Kevin, you were also talking about those who were teaching full classes, but my understanding is this would also apply to anybody who has a support staff role inside a packed classroom as well. So it's not just about those who would be teaching, but our support staff members in that position as well. So it's a question about roles, but a question about tiers, if you would, Kevin.
Thank you very much, Robin, and thanks to Paul for that question. Yes, our position is for the whole of the country. So that is the tier 3 and the tier 4, and I think the very small tier 1 area that's left as well. And clearly the cases are higher in the tier 4 areas, but the direction of travel in school children was the same across the country. And we believe, and this is the advice from SAGE and the others, so SAGE's advice isn't about tier 4, it's about the whole country. And it's important to get ahead of the virus sometimes, to stop it before it grows. It's harder to get it down. So it does, our advice does apply to the whole of the country. And yes, Robin is absolutely right. Our advice applies to our support staff members as well as our teacher members. The letter on the website refers to not being available to teach or support in full classes. So it's about teaching in a full class or about supporting in a full class. The point being that in those crowded classrooms that we have, social distancing isn't possible, PPE isn't there, and so it does apply to both our teacher members and our support staff members.
Thank you very much, Kevin. And I'm going to turn to Mary. And Mary, there'll be quite a few members on the call who will feel perhaps just a little bit uncertain about making this decision. They'll know it's the right decision, but I guess it's a little bit like when we're working with some of the students in our schools, helping them to make the right decision sometimes requires a little bit of confidence, a little bit of assurance about doing the right thing. We know that this is the right thing for our members, each individually, to say no. But we've got a question from Katie Lydon. She says, thank you for your support at this very challenging and uncertain time. And she says, will this be classed as a strike if we do not go into school? If so, will this impact on our pay? And I'm going to add in another question, if I may, Mary, to kind of blend them. So there's a question, what is the status of this action? Does it have an impact on pay? And of course, Katie, of course, will be clearly able to continue working from home anyway. But there's a second question that relates to it, which is around what's the union stance on having all members of staff in school at all times, when we know we're only going to have a handful of children, instead of doing a rota as previously? Surely that's not necessary to actually require staff to be on site, other than the few who might be involved in that role. So a couple of questions, if you would, Mary. Thank you.
Thank you, Robin, and thank you, Katie, for that question. This is emphatically not a strike. The union is not advising you to withdraw your labour. We have not held a ballot. We are not taking industrial action. You have a right to work in a workplace which will not endanger your health and your safety. And what the union is saying is, as a result of the advice given by SAGE and by many other scientists, it is not safe to go into a crowded building with hundreds of pupils, with no social distancing, particularly in primary, is no social distancing, with no PPE and with inadequate ventilation. And you have a right under employment law to work in a workplace which will not endanger your health and your safety, and also will not endanger the health and safety of other people. So we are also exercising this right on behalf of parents who don't want to catch COVID from their children, on behalf of grandparents who don't want to catch COVID from their grandchildren. We know that children are highly unlikely to be severely ill from this virus, but we do know that they can pass it on very effectively. We know that secondary school age children, in whom viral levels are the highest of any age group, are 7 times more likely to pass the virus into their households than any other age group. We know that the modelling by Imperial College says at the moment the new variant is between 1.4 and 1.7 reproduction rate. It's either 40% or up to 75% more infectious than the old COVID. That's not to say that people will get more ill, but they are more likely to catch it and catch it more quickly. So we are asking you to exercise this right to work in a school which is secure, which is not going to endanger your health, both for yourselves and your community. And you are not withdrawing your labour, because you are saying, and we say this very clearly in the letter to your head teacher, that you will work from home, you will provide remote learning for your children, and that you will go into school, unless you're clinically extremely vulnerable or at high risk, where you shouldn't, you will go into school to look after and care for and teach the children of key workers and vulnerable children. So that's the first thing. And if anyone is threatened with a loss of pay, that is not right. And be quite clear, but the main leadership unions, ASCL and the NEHT, are advising their members that if teachers or support staff write to them on a Section 44 letter and say, I am not coming into school because it's not safe to do so, apart from to work with key worker and vulnerable children, that they cannot say back to them, well, it's actually safe, so you must come in, or else I'm going to discipline you or penalise you. That they should not be saying that. They should be accepting that, and accepting that that teacher or that member of support staff will be working from home, because they have exercised their right under Section 44 to be working in an environment which safeguards their health and their safety. And secondly, if you're being required to go in when in secondary, when there are the key worker and vulnerable children in this week, and if the head's requiring all staff to go in, that is just unacceptable, because there is no need for it. Secondary colleagues will be working from home. It is unacceptable for them to be required to go into a building and to risk catching this infection from other staff. We should minimise the risks. The government says work from home if you can, and that is true for all workers, including teaching and support staff. Work from home if you can.
Thank you very much, Mary. And Mary, I'm going to come back to you in just a moment with questions from Maya and Emma about different particular circumstances that may be reflected across individuals on this call. But Kevin, perhaps you can help everyone on the call with some information about the letter that needs to be sent. So we've got a question. I'm going to read 3 questions out because they reflect different aspects of this. We've got a question from Rebecca Hill. Rebecca, thank you, who says, good morning, is there a Section 44 letter for special schools? So she's kind of asking, do we need to have different letters, or is the one central letter that's been issued sufficient for all context? So Rebecca's question might also apply to maintain nursery schools, post-16 settings and so forth. Victoria Lindsay asking a very straightforward question: can non-union members sign the letter? So that's a question about whether this is something that is exclusive to any EU members or whether other individuals could sign that letter. And finally, I think Mark Taylor, and Mark's asked a really helpful question. So thank you, Mark. Mark says, I'm really worried. And that's an interesting reaction, actually, first of all, just to note that there will be many of you who will be feeling a little bit of anxiety, a little bit of uncertainty, but you don't need to. Mark's question reads like this. The section 44 letter, can it be sent by the reps with members' names at the bottom so we don't have to send it ourselves? I keep hearing different things. And I think that, Kevin, as you know, is around the fact that it's an individual right that we're exercising here. But of course, it can be done by a group of people who all individually agree. So, Kevin, perhaps you can just talk us through aspects of that. Thank you.
Thanks, Robin. And do you mind if I just say as well, on the question previously about coming into school, that we've been told of numerous cases where, as a result of a staff meeting in person, and then one person getting a positive, that a school had to close and not be able to provide anything, including in one case of an Ofsted inspector taking the infection to a school meeting. So there are very good practical reasons for not meeting physically. But on these questions about the letter, so Victoria's question is interesting about whether non-union members can send the letter. This is an individual worker can assert their right not to work in an unsafe environment. So if somebody who is not in our union finds that letter on our website, they can send it. Now, obviously, we would encourage them to join our union, but a non-union member can send that letter because there is an individual right attached to it. The question of whether that letter has more general application, it does have more general application. Now, we are focusing our advice currently on primary, early years and special school settings on this call because they are opening next week, but there is a more general application and you can amend that letter to a degree that is appropriate. You need to have a solid basis for thinking that it's unsafe. And our advice to you is the fact that SAGE and the Imperial College and the London School of Tropical and Hygiene Medicine and London School
of Hygiene and Tropical Medicine.
Thank you. Getting stumbled over that. The fact that we've got that really strong advice means you have a really strong basis for asserting this right. Mark's question about the worry, we really understand that. Because in law there is an individual aspect to this, I think the best route is for you to sign this letter individually. But there is no reason why a school rep couldn't gather a group of those letters together and then send them to the head teacher with a covering note saying, dear Robin, if it was in Robin's school, here are section 44 letters from 30 colleagues on the staff, here are their names. And then you both have a collective, but the rep there is collecting together the individual responses. And I think that would be the right way to approach it. And I hope, Mark, that would give you some sense of, I guess the worry comes from the feeling of isolation, and there is a way of collecting them together that can help to overcome that, but it doesn't stray away from the fact that this is an individual right that you have, and there's an important aspect to that should be honoured.
Thank you very much, Kevin. And we've got some questions coming in. They're a little more specific, but I still think they're really important questions. So we've got a question from Emma Carter. Good morning. What are your recommendations for vulnerable employees? Should they be in school to support key worker children? Or should vulnerable employees be working from home at all times? And we'll need to distinguish there between clinically vulnerable, clinically extremely vulnerable, and other categories. And then there's a question from Maya, and thank you, Maya, for your question. I'm not going to identify too much about your personal circumstances, but Maya's asking a question around her NQT year, and we will have people on the call who are trainees. Fabulous to have so many trainees in membership of the NEU. Fabulous to see NQTs in membership of our union. So there's questions about qualifying periods and the amount of time that they have to spend in the classroom. So Mary, perhaps you can help with those.
Thank you. So Emma, thank you for your question, a really important question. So from the start of this pandemic, the union, the National Education Union, has said that clinically extremely vulnerable education professionals should not be in schools. They should be working from home. There is a lot for them to do at home in supporting children who are isolating, supporting children who have to be isolating because they've been in close contact with a COVID case, or that they have COVID themselves. You know, these children are highly unlikely to be very ill, or to really, you know, many times they'll be asymptomatic. So they need to work, and they've got work to do. And colleagues have been supporting children doing that. Teachers have been setting remote learning, and support staff have been doing an awful lot of pastoral care, and teachers have been doing a lot of pastoral care working from home. And none of that stopped throughout the pandemic. None of that stopped in March when schools were closed. Clinically extremely vulnerable members should be working from home. Clinically vulnerable members, we still think that they should be protected and work from home as well, but the case there is more difficult to secure that. So we have said that clinically vulnerable people should be wearing medical grade masks, and that they should be given extra protection in terms of social distancing in the workplace. And then how will it affect your NQT year? Well, Maya, what you're not doing is saying that you're not working. You are not, by sending in a Section 44 letter, saying you're not working. So you will be working. So it will be as possible to carry on with your NQT year, and possible to provide evidence to your employer that you are meeting the qualified teacher standards. So, you know, and you say that your partner is vulnerable and is shielding. I think it's very important, if your partner is vulnerable and shielding, that you're not in school, because our argument is, based on the evidence from SAGE and from many other scientists and from Imperial College, that schools in the current pandemic, where we have over 50,000 new infections a day, when we have the highest level of hospital admissions, nearly 24,000 people seriously ill with COVID in hospital, it is important that you keep safe. And it's not just important for your health and for the health of your community. This is also essential for the NHS. If the NHS is not going to be overwhelmed, then we need to keep well, we need to keep safe, and we need to keep our communities safe. So you are not withdrawing your labour, you're saying that you will work differently, and therefore you have a right to carry on with your NQT year.
Thank you very much, Mary. Really helpful, clear advice. And I'm going to turn to Kevin, following on actually from Mary's repeated use in that response of the notion of school being safe. I've got a question from Abby, and I think it's a really important question. Abby Simmons says, is it possible for the notion of safe to be clarified? A big problem schools have faced is that the government notion of COVID safe schools does not bear any resemblance to safety. And I think it's fair to say safety in any other context. This lack of definition means that they can get away with saying that schools are safe. We need more clarity on what safe means to be able to have these conversations. And I think critically, Kevin, there's something that has informed the NEU's position here. And that is that there has been a significant shift in the advice of the government's own scientists around this. And I think that's probably where we would want to focus some of Abby's thoughts. But Kevin, is it possible for the notion of safe to be clarified? What do we mean as a union by that?
That's a really important question. The Prime Minister has been on the Andrew Marr programme this morning, and he said repeatedly that schools are safe. So what does he mean by that, and what's his evidence for that? Now, I think the only way he could possibly defend that statement is by referring to children, that it's safe for children. And I think that is possible to maintain, because children will pick up the virus at school, but the vast majority of them will not get ill with it in a serious way. But it is not possible to seriously maintain the contention that schools are safe for others. So we are able to rely on the scientists in this, the scientists from SAGE and the other places we've been talking about. We're able to rely on the fact that the Office for National Statistics shows that cases were going up sharply among school-age children. In the legislation around Section 44, you can use that protection if you've got a reasonable or well-founded case that you're unsafe. And nobody can deny that, that a reasonable, well-founded case that the setting is unsafe, either for you or for others. And really, nobody can deny that. So it's your union's advice, based on the science, that because cases were going up, that shows that schools were not sufficiently COVID secure to stop cases going up. Because you in your workplace do not have social distancing and do not have PPE, so you don't have the protections that could stop you contracting it. And because SAGE say that with this new variant, the R rate will not go below 1 if schools do not close, then our community is also at risk. And that is a very strong basis for us to assert that it is not currently safe for schools to open. Now, that advice can change if the government introduces new measures that keep schools COVID secure. It can change if the scientists change their view of the new variant. So it can change over time. But right now, your union's advice, based on the science, and we are really confident that this would withstand all challenges, is that schools are not currently safe. And so we're urging you to act on that. It's not safe in your union's advice based on the science. And do you know the point that Mary made before in our original presentations? I think it was Mary that said it rather than me. We know from our conversations with NAHT and ASCL that that's what they're telling their head teacher members as well. They are saying that if you say to them it's not safe, that they don't have a legal basis for telling you that it is safe. So we are in a strong position here. Use your union advice. We have to, because the government isn't coming up with sensible definitions of what is safe, your union is coming up with a sensible definition based on the science, and you can rely on us based on the science in this assertion.
Thank you very much, Kevin. I'm just going to take 2 quick questions. These relate mainly to secondary and post-16 contexts, but important questions for Mary to answer. And then we'll move, as we are heading towards 12 o'clock, we'll move into kind of some summary, key actions. And Kevin, I'll come back to you with a kind of question around direct specific advice. What should everybody on this call now do? But Mary, the ones that have just come through from our wonderful technical team, and I will say thank you to them, because with this scale of call, we've got an extraordinary number of people who've given up a huge amount of time over the last few days to make this happen, and thank you to every one of them.
Thank you.
So we've got a question around testing. It's principally around this screening, this approach to screening students using lateral flow testing that's been proposed for secondary schools. Rachel Peter says, if they're planning on testing teachers and/or students, who will be doing the testing? Is there a clear strategy for implementing the testing? And there's a suggestion that people who've only got very basic first aid training might end up doing some of the testing. Is it safe? So a piece about testing and a response from the union on that, and a related question, secondary post-16, from an exams officer. Ruxana, thank you very much for your question. We've got exams coming up in January. What's the union's position in relation to the delivery of those exams? Thank you, Mary.
So thank you, Robin. So thank you, Rachel. Now, the testing, the lateral flow testing, I think it's just important to say a few things about that. The government has said that the Army will be supporting schools, but what that support means is the Army will be delivering the tests, and the Army have done some webinars to show how the test should be supervised. The testing will be done by the students themselves and by the staff themselves. They'll administer the swabs either down their throat or up their nose themselves, but they will be supervised. And the government is saying that this should not be done by teachers or support staff because they have jobs to do. It should be done by volunteers. So on the last day of the last day of the Christmas term, the government told head teachers that it had to set up a system to recruit volunteers to start this testing from the 4th of January. That was always going to be an impossible ask. Now they're saying from the 11th of January, and we will have to see how that goes, but it should not be something which teachers or support staff are doing. We have grave doubts about the testing programme. We hope we're wrong. We hope that it works, and we hope that it does identify students who've got positive tests. But the scientific evidence on that is dubious, is doubtful. On the best estimates, the lateral flow tests pick up about 60% of cases. We know that children are highly likely to be asymptomatic. So the danger is that if you just test all the pupils in the school twice, and that will be a huge logistical job. Can you imagine a secondary school of 1,000 pupils having to arrange 2,000 test slots, because every school should be tested twice? But from that time on, it's the pupils who've got COVID will be told to isolate, and their close contacts will continue to be tested. But the point is that, you know, it's likely, indeed it's probable, highly probable, that many pupils who have COVID will not be identified by these tests. And the danger is that that could increase COVID levels in the age group, not decrease them. So we have clear doubts about that, and we are attempting to engage with government about the lateral flow testing. It's never been tried in schools before. It's never been tried with this age group before, and we are concerned about it, because we're concerned that it might give a false sense of security. But the key issue is support staff and teachers should not be doing it. And the exams officer's question, well, we have no desire to stop exams. These qualifications are essential for young people, but they have to be done in a safe way. Now then, so exam halls full of 200 people, young people, that is going to be extremely difficult. You can socially distance more with exams. It is a very controlled environment, and you can stay more remote, but we will be looking at that issue further next week. I reiterate again, we have no desire to stop young people taking these exams. They are essential for their life chances, but we do want them to be done safely.
Thank you very much, Mary. And just to underline the point about the testing, I think it's probably worth everybody on this call hearing the fact that the testing protocol that's being proposed by the Secretary of State has not been authorised by the Medical Health Regulatory Agency. So we ought to be asking really serious questions about its appropriateness to be used in this way. And when we get those answers, we can give good advice, but we don't yet have those answers. So, Kevin, we've got 20,000+ people listening in. What should they now do? These fabulous members of the education workforce, our members dedicated to the best possible provision for the children and young people in their care. What should they now do?
We would like them to find the letter on our website or in their email, to look at that letter, to think about the science that we've been talking about and our advice on that. We know in the union centrally of head teachers, support staff and teachers who died over the Christmas period. We don't know of huge numbers, but we do know of people in all those categories who died. We know of grandparents who've died. This is a real question for the whole of our society. We know that the daily case numbers are higher than they've ever been. So we want you to look at that letter. We want you to talk to colleagues. We want you to send that letter to your head teacher. We want you to sign our petition. We want you to ask your friends and family to sign that petition. We want you to ask your colleagues to sign that petition. If you're in a school without a rep, we would like you to volunteer to become a rep. You can have multiple reps, so you can volunteer along with a colleague to share the role of rep in your workplace. And most of all, we want you to be confident that you and your union and the other education unions, that we are acting in the best interests of education and of our society. We want you to be confident that we are talking about how do we educate children online. We want to engage and do that to the best of our ability. We want to work with the key worker children to make sure they can be in school so the NHS can keep running, so that the Tesco delivery drivers can still deliver the food that we need. We want schools to be open again. We want the government to engage with us on safety protocols that can make it possible to open again. We are acting really and truly in the best interests of community and of education. Stick with your union look at your union's advice. Sometimes, you know, we heard that people can be worried. Sometimes there are times to be brave. Listen to the union's advice, make the right decision based on the union's advice, look at the letter and help us make it better for everyone in our society.
Thank you very much, Kevin. And we have had somewhere close to 100,000 people following either on Zoom or on the YouTube feed.
Wow.
Thank you to every single one of you who has listened in. And we would ask you now, firstly, to take away our thanks, our profound thanks for the extraordinary and exceptional work that you, our education workforce, has done throughout this pandemic. You are valued, you're treasured, you're fabulous people. I work alongside many of you every single day. But also now is the time to trust both your professional instincts and your professional ethics. It's time to say no. Thank you very much indeed for joining the call. We'll be getting as much advice out to you as we can over the next few days. Please be patient. We will answer as many questions as we can. Thank you again and have a good day.